Thank you. Thank you, Rob. I'm Eric Schneiderman, the New York State Attorney General, and it is a true pleasure to be here today with the folks who made something very good that has never been done before in any state happen. We're here to talk about progress we've made in the battle against the rampant abuse of prescription drugs. Today marks the one-year anniversary of the enactment of the I-Stop law, and it marks the perhaps the most important element of the law going into effect. And we're joined here by the people who have gotten this amazing, groundbreaking program in place. My colleagues in government, Senator Andrew Lanza and Assemblyman Michael Cusick. Also with us is Terry Kroll, a mother from Long Island who tragically lost her son to addiction caused by irresponsible overprescribing. And Dr. Jeffrey Reynolds, the Executive Director of the Long Island Council on Alcoholism and Drug Dependence. Rob, of course, our host, is a pharmacist. We had a lot of support, and we could not have done this without the support of medical professionals, without the support of family members who took their pain and turned it into action, like Terry, and, of course, the sponsors in the Assembly and the Senate, my colleagues, Andrew Lanza and Michael Cusick. Great to work with them. And I do want to point out that they managed to get this passed by a total vote in the Assembly and Senate of 174 to nothing. So at the end of the day, the coalition that we assembled was able to persuade everyone that it is in our interest to have a system in place where we can track prescription drugs, and the I-Stop system. I-Stop stands for the Internet System to Track Over-Prescribing. It is unique. It is great to have in effect, and today is a key day in the history of I-Stop and in the history of the fight against overprescribing prescription drugs in the United States of America. So we're back here at Delco Pharmacy. We were here a year ago to kick off our campaign, and it is a tremendously important day because today the mandatory checking of our internet database goes into effect. From now on, the internet database that has been set up for I-Stop is going to be checked by every pharmacist and every doctor who dispensing, in case of doctors prescribing, in case of pharmacists filling the prescription, a prescription for a narcotic painkiller. We're talking about prescription opioids, and this is going to enable doctors and pharmacists to counsel patients, to see if someone has too many prescriptions, or if there are dangerous drug combinations that could have a bad effect. It will also enable us to see very quickly where there are patients who are going from doctor to doctor to try and get many prescriptions who clearly are not using them all themselves. And this has been a particular problem on Staten Island, as I'm sure you know, and one of the reasons the political leadership to get I-Stop into place came from Staten Island. My office took down a major drug trafficker here earlier this year who had thousands of prescriptions for oxycodone pills and other dangerous narcotics, was stealing them all over the metropolitan area. And we know that these criminals, these drug dealers, can often turn violent. People have been shot in New York State, people have been assaulted, people have been injured, and it is a major crime wave that is preventable, and today we take a major step towards ending it. So we know that I-Stop has already started to reduce the supply of opioid painkillers even before today's mandatory verification program took effect. Doctors who previously were prescribing large quantities to patients who then became addicted have cut back. Smaller numbers of pills are being prescribed. We know drug companies are delivering smaller numbers of these dangerous medications to pharmacies. Some of the victims have shifted from prescription drugs to cheaper street drugs. That's exactly what happened to Terry's son. He went to a doctor because he had migraines, was prescribed a large amount of oxycodone, and eventually ended up using cocaine and heroin, had a heart attack at the age of 23, and the doctor that got him hooked by overprescribing is now in prison. No mother should ever have to go through that and have our own medical system, our own healthcare system, essentially hook their child on drugs. So I'm very proud of this, and I want to call to your attention the fact that the Federal Centers for Disease Control have referred to iStop as a model for the nation. The director of the centers wrote an op-ed column this week praising iStop and calling it a national model, which it is. And Staten Island has been in the front lines of this fight. You've provided the legislative leadership, you provided the moral leadership. You're going to benefit from this, and really, we know that in recent years, the overdose rate in Staten Island has been rising 4 times faster than in Manhattan, Queens, and Brooklyn. We're going to put an end to that starting today when the iStop system goes into effect. And look, most doctors and most pharmacists are good medical professionals who just want to treat people. This is going to enable those doctors and pharmacists to counsel folks who are seeking too many prescriptions, to cut down and keep track of prescription opioids, and it's going to enable us to catch the very small number of bad actors who are responsible for this, really this crisis and this crime wave. So with that, I want to bring up Terry Kroll, who is one of the true heroes here. We could never have gotten this legislation enacted over the objections of many folks in the industry without the courage and the tenacity of the parents who stepped up and the family members who stepped up to say, we're not going to take no for an answer. We're not going to listen to the idea that this is too inconvenient. You're killing people. We want action. We got it. And Terry, thank you for being here with us today, and thank you for being here with us in the struggle to get this important legislation into place.